Retirement living is on our minds every Saturday morning at this time on KFOR. It is the Aging Adventure, brought to you by The Legacy. I'm Dale Johnson, joined by John Kopetsky, Executive Director of Legacy Terrace at 5700 Fremont Street, and Kathy Blythe, who has an award-winning history here on KFOR and a deep connection to The Legacy. Good morning, Kathy. Good morning, John.
Good morning, Dale.
Mr. Dale, good morning, sir.
On the Aging Adventure this morning, registered nurse Barb Scott, Director of Clinical Operations for Legacy Retirement. We'll talk about understanding osteoporosis. But right now, Medicare is on our mind with Dr. Kyle Haefele from the Lincoln Family Medicine Center.
We hear occasionally about the annual Medicare visit with your doctor. Can you tell us a little more about that and how people should take advantage of that?
Sure. This is a great topic. I really appreciate you guys having me on. The annual wellness visit that you're told about every year to go see your doctor and get your annual visit, it has a really specific definition, and according to Medicare, and I think it's often misunderstood by some patients and some doctors. And so I wanted to just throw a little light on that today, if I could. A lot of times, the reason that these are done is that we know through studies now that when people come in for their annual exams and do some healthcare planning with their doctors, that they live longer and better. They can make more choices about how they get to live and where they get to live, instead of having some sort of a medical problem or disaster that sort of dictates where they live. I guess my example of that is with my own parents. They both lived at home and took care of themselves until they were both in their 90s. And as they started to have a little trouble taking care of themselves in their home, we really encouraged them to make their own choice as to where they wanted to go next, if that was a retirement community that could provide some meals or a full assisted living type of a community. Because the option in their small town would have been if one of them had a medical problem or fallen and broken a hip or something like that, they would not have gotten much choice as to where they went after their hospitalization. Usually you'll go to some sort of a rehab facility, and in that small town, there wasn't a lot of choice as to where they might have gone, and they took advantage of the ability to make that choice ahead of time rather than wait for a medical problem to dictate where they were going to go.
The Medicare wellness visit is different than what we used to think of as an annual physical, or maybe that still happens for younger people.
Right. The annual physical exam is sort of we learned that just doing a physical exam doesn't give us as much information as really going through all of the history that we need to go through. So the Medicare annual wellness exam has some very specific things. And so when someone comes in to see me for a wellness exam, we give them a little bit of homework usually to do. There's a questionnaire that they fill out, actually more than one questionnaire that they fill out ahead of time, and we start gathering that information. So we'll do really, I captured into 5 main things. You want to update the chart. So I want to make sure that I know all about your medical history. If anything happened long ago that I didn't capture in my chart, or if anything happened in the last year that I might not be aware of because you went to a cardiologist or got a cataract surgery or something that I didn't see you for. So I want to make sure all that's updated and I have your medications all current. And then we ask about whether or not you've been screened for certain diseases. We always want to screen for breast or colon cancer, hepatitis C. We want to make sure that your blood pressure is checked, things like that. And those are all screening for diseases that might not be a problem today, but they will potentially become a problem in the future. We also want to make sure that you've done some preventative things. Oftentimes in the course of our busy medical care, when we're dealing with the other medical problems people have, whether it's diabetes or high blood pressure or whatever, we forget to ask if they've had their shingles vaccinations, or forget to check if you've had your tetanus shot done recently, things like that. So the fourth piece is we want to try to identify if you have any risk factors for any declines in your activities of daily living, and how things are going at home. And then we want to plan for the future, just like I was talking about with my own parents. What kind of living situation is going to be best based on your own desires and healthcare plans. Do you have a healthcare power of attorney or a living will that you've discussed? So all of those things are the discussions that you might have at an annual wellness visit, and it gives you the opportunity to do some of the important things that aren't necessarily something that is related to your immediate today's health.
Great information, Kyle, and I know we have a lot more to discuss, and we will ask some of those questions and discuss those matters after the break here on The Aging Adventure, brought to you by the Legacy Retirement Communities.
Welcome back to The Aging Adventure, brought to you by the Legacy Retirement Communities. I'm Dale Johnson with Kathy and John, who are taking us into the world of Medicare today with Dr. Kyle Haefele from the Lincoln Family Medicine Center.
Kyle, you, before the break, had talked about the Medicare visit and preparing for it. I know there's some specific steps people should do to make that visit as productive as possible.
In particular, making sure that you know your medical history and know your medicines, or bring in a list of your medicines is good. At our office in particular, we have some paperwork that you'll fill out. Things like, how are you doing on your activities of daily living, or ADLs, you'll hear them called sometimes. And ADLs are like bathing, dressing, getting ready to eat, things like that. Or there are also instrumental activities of daily living that are a little more complex, things like doing your laundry, doing your shopping, managing your checkbook, driving a car, things like that. So we'll ask about all of those things. They'll ask about your vision and hearing, and a lot of things that your doctors may fail to ask you when they're dealing with the other busyness of taking care of your medications. So all of that paperwork will be usually done ahead of time. The visit itself usually is going through all of that paperwork and then trying to decide how any yes questions or any potential problems that are identified, how those relate to your goals of care and what sort of choices you would like to make for yourself in the future. I guess, and as an example, I want to know, for all of these treatments and all of these things that we're talking about, how does this affect my longevity, my ability to live for a long time? So is a treatment really giving me a longer life? Is it making me more functional so that I can walk? I'm getting pain medicine for my knee so that I can walk more, or does it just make me feel better today? And it really doesn't do either of those other two things, help me live longer or more functional. And those are the types of choices that we would talk about when we're talking about your medical care and the types of choices that you might want to do in the future.
Can you give us an example of during this questionnaire and fact-finding during the Medicare wellness visit? What do you do, Dr. Haefele, if you ascertain that somebody should not be driving
That is a fantastic question. There are a lot of things that we can do. The first thing that I do is I ask them how they feel driving, and if they feel like they're doing okay driving, but I think that they maybe are having a little bit more struggle, we have some options as far as enlisting some family help. Or enlisting even the help of some of our physical therapists and rehab colleagues who can do actual driving testing. If push really comes to shove, doctors can contact the DMV and say, we really think that this person needs to undergo the actual driving test before renewing their license the next time.
Those can be very difficult conversations to have, I'm sure.
They are very difficult. It's driving is a huge independence factor, and as is sometimes deciding if you want to move from your home into a different sort of a living environment. But usually we can make those conversations to where sometimes that really is in somebody's best interest. When we ask questions like, can you give me an example of what's a good day for you, and give me an example of what's a bad day for you, that gives us a lot of insight into someone who has social isolation and might really benefit from living in a more of a senior living community type of a place versus being at home alone, or someone who's depressed. And we do depression screeners, and that unfortunately turns out to be a more common and more common thing than we would like to see. And people tend to deny that they have problems with it because they feel that there's a stigma behind being depressed.
Dr. Haefele, we had so many other questions that we wanted to ask you today, and we find ourselves almost at the end of the show. So we certainly hope that you will come back again and visit with us. And if the biggest impression that we left today is how important those annual Medicare wellness visits are, I hope that is really imprinted on people's minds and hearts, that they really need to do that it can make all the difference in the quality of life and the length of life.
Yeah, I really appreciate this opportunity. Thanks for that, Kathy, and I'd be happy to come back and talk about another topic sometime if you would have me.
Thank you, Dr. Haefele. Coming up, Understanding Osteoporosis, when the aging adventure continues, brought to you by Legacy Retirement Communities. We continue the conversation on the aging adventure, brought to you by Legacy Retirement Communities here on KFOR. I'm Dale Johnson, joined by Kathy Blythe and John Kopetsky. Now joining us, registered nurse Barb Scott. She's Director of Clinical Operations for Legacy Retirement, to help us understand osteoporosis.
Good to have you back with us again, Barb. And we did want to zero in on osteoporosis today because we feel like it's getting more attention than it used to, and that we know more about it. But it's so easy to put that into the "I'll worry about it later" category, or that's going to happen to somebody else and not to me. So at what age does osteoporosis start showing up, and when should we start having screenings?
Well, good morning, everybody. Yes, osteoporosis, I I wish that it was talked about a little bit more. But I do feel it does get some attention out there, which is awesome. First, let me give a quick definition of what osteoporosis is. Osteoporosis is a bone disease that occurs when the body loses too much bone, makes little bone, or both. Osteoporosis means porous, so that means that our bones are porous. So there's a lot of those minute spaces in there, which makes our bones easier. We can have a fracture easier if we have osteoporosis. So osteoporosis is age-related. We start watching it ages 50 or older. That's when we start keeping an eye out on it. And we do, it's diagnosed with a bone density scan, or it's diagnosed when you have a fracture, an easy fracture, and then they start looking into osteoporosis at that time.
If you have a family history, should you start being screened earlier than you might otherwise?
A family history, it is a risk factor, but I believe that the physicians will still recommend 50 or older. But it's sure, the bone density test is very quick, and so it's very easy to do. But family history is a risk factor.
Is it true that this is just a normal part of aging? If we live long enough, we're going to get osteoporosis, or not necessarily? And is it more in men or women?
So yes, let me give you some general statistics about osteoporosis. Approximately 1 in 2 women and 1 in 4 men over the age of 50 will have a fracture related to osteoporosis in their lifetime. Osteoporosis does happen more frequently in women than it does men, and that's because of women's lack of progesterone and estrogen production. So our bones do become a little more porous prior to a man's bones becoming more porous. People who have osteoporosis have had a fracture have a 50% chance of getting another fracture because of osteoporosis.
That's very eye-opening and attention-getting. What can we do? What is within our control to do lifestyle-wise to possibly stave it off or prevent it altogether?
That is a great question. Osteoporosis, it is preventable and it can be controlled. If you go in and have a bone density test and your physician diagnoses you with osteoporosis, they may start you on a prescription medicine, but along with that, there are other things that you can do. First thing would be weight-bearing exercise. Very important. That weight-bearing that we have on the legs, on the hips, that's very, very good. Why is weight-bearing so important? Because it is the best for your bones because it forces you to work against gravity. So that's very good. Activities would be walking, hiking, jogging, climbing stairs. Weight training is good. Mm-hmm. Secondly, muscle strengthening exercises such as yoga, swimming, and would be great exercises to prevent osteoporosis. If you smoke cigarettes, you need to stop because that adds to it adds to your risk. Limiting alcohol intake is another big one. And then the other two are to make sure that your diet contains enough calcium and make sure that your diet contains enough vitamin D. Those are the biggest things that we can do to prevent and control osteoporosis.
Excellent information, Barb. Do you have a success story that you can share with us?
Our communities have a great fitness program. And so in my mind, the success story would be all of our residents over the age of 50, over the age of 75 that are down in that fitness center doing their exercise, doing the chair classes, doing those weight-bearing exercises, and they are doing what they can do to prevent osteoporosis.
That's a great success story. And it's something that we needed to know more about and that we encourage people to find out more about, to have that discussion with their doctor and to get into the wellness programs. And hopefully we've all learned from what you have to say today. And we'll take it upon ourselves to get more information and to get those checkups when we should get them, to get those DEXA scans and know our numbers and do what we can to improve the situation.
Absolutely. Those bone scans, a bone density scan is quick. It takes you longer to check in to get the scan as opposed to getting the scans, like 90 seconds. So it's very worth it.
I always say, is it over? It's
Absolutely.
over already?
Absolutely.
We love talking to you and learning from you, Barb Scott. Thanks for all the good things you're doing at Legacy, and we'll visit again.
Thank you, Barb. It's been a good conversation today, Kathy. Thank you very much for joining us. Have a good week.
You have a good week, too. We'll talk to you next week.
And John, thank you for being on The Aging Adventure. Every Saturday morning here on KFOR, it's The Aging Adventure, brought to you by Legacy Retirement Communities. I'm Dale Johnson.